The opinions and views expressed by guests on the Golden Nuggets Health and Wellness shows do not necessarily reflect the views and opinions of the host or those of the station. Additionally, any medical advice shared by guests is not intended to replace the advice provided by your healthcare providers. It is important to exercise discretion and take responsibility for your own health choices. While the Golden Nuggets Health and Wellness shows aim to provide valuable information on holistic health for the mind, body, and soul, individual circumstances vary, and what works for one person may not be suitable for another. Viewers and listeners are strongly encouraged to consult with qualified healthcare professionals, nutritionists, or other relevant experts before making any significant changes to their lifestyle, diet, exercise routine, or adopting new practices discussed on the show. These professionals can offer personalized advice based on your specific needs and health status. The host, guests, and producers of the Golden Nuggets Health and Wellness shows disclaim any responsibility for consequences arising from the use or misuse of the information provided. By engaging with our content, you acknowledge that it is not a substitute for professional advice, and that you will seek guidance from qualified professionals as needed. Thank you for being a part of our health and wellness community.
Welcome to Golden Nuggets Health and Wellness Show, the television program that's redefining self-care for the mind, body, and soul. I'm Dr. Elect Starr. I'm a licensed mental health counselor, health and wellness consultant, and your host for this show. Our mission is simple: to empower you with creative and innovative self-care strategies and resources that help you prosper and be in good health, even as your soul prospers. Ladies and gentlemen, welcome to our new episode where we delve into a topic close to our hearts: self-care for the Black community, mind, body, and soul. But what exactly is self-care? Well, it's not just a buzzword. It's a deliberate practice aimed at enhancing our physical, mental, and emotional well-being. Today, we'll explore the many benefits of integrating self-care into our daily routines, with a particular focus on physical health and well-being. However, self-care isn't a one-size-fits-all solution. What works for one person may not work for another. That's why it's crucial to explore various activities and strategies to find what best suits our individual needs and lifestyles. Before we dive into our conversation on physical health and well-being for the Black community, let's take a moment to acknowledge one of the many strengths within the Black community: education and achievement. Despite facing systemic barriers to education and opportunity, many Black individuals have achieved remarkable academic success and professional accomplishments. Education is valued within the Black community as a pathway to empowerment, social mobility, and collective advancement. Today, we honor that education and achievement and stand alongside you, offering strategies, tools, and resources to enhance your physical health and well-being, and to encourage you: take care of your body. It's the only place you have to live in. So during this first half, before we begin our first half, I'm going to introduce our esteemed guests. We have with us today Dr. Morenci Powell. Good morning.
Good morning.
And welcome to the show.
I'm so happy to be here.
It's an honor to have you. Can you tell us a little bit about you and what you do?
Yes, Morenci Powell, as she said, I am a medical science liaison in the pharmaceutical industry. New to this role, but I act as a scientific educator to providers regarding different drugs within a company's portfolio. I have been in science and scientific research for 10 plus years, particularly studying cancer, but overall disease and human health.
Wow, what an accomplishment. Thank you so much, Dr. Powell. Appreciate you being here. And I'd like to begin our discussion with you sharing with us, how do you define self-care in the context of physical health and well-being?
I define self-care as intentionally nourishing and nurturing one's whole self with regular exercise, with proper diet, well-balanced diet and proper sleep, and protecting one's mental health. I think they all come together to support physical health.
I agree. Thank you so much. And Dr. Powell, how does racism affect the physical health of Black Americans? And what are some ways to cope with it?
If you think about it, there's been a longer history of trauma in the Black community as it pertains to racism than there has been time to heal from it. And if you think about that, the centuries worth of trauma that the Black community has experienced, you can think of it as chronic stress. Chronic stress has been directly associated with disease. And if you think about it on a more granular level, so when a patient or a person is in chronic stress, they're generally in fight or flight mode. And in that fight or flight mode, you have the release of these cytokines. And they're not the only mediators, but the release of these cytokines and perpetual release of these cytokines damages cells and tissues and thus organs, which leads to disease. So some ways to cope with it are finding ways and people and spaces to talk about these things so you don't internalize them. Finding people to share laughter with, because it's actually scientifically proven that laughter is actually not just good for the soul, but the body too. Laughter actually heals and joy actually heals. And also being the change we want to see, just like Mahatma Gandhi coined, be the change you want to see. So find ways to get involved to make changes in your local community.
I really appreciate what you just shared. First of all, I appreciate the fact that you highlight trauma, the impact of trauma. A lot of people played that word down, and they don't take it seriously. I know in my work, I address trauma quite a bit because you see adults who may have experienced childhood trauma and they're still suffering from it. They may not be able to identify that it is trauma or childhood history of trauma, but they know they're having some problems. And so I appreciate the fact that you highlighted trauma, and then you also highlighted stress. And then laughter. You don't hear people talk about laughter as medicine, but I'm also just delighted to hear you mention that, because that's one of the things I tell clients to do. That's one of the most least expensive tools.
Absolutely.
I mean, something as simple as picking up your cell phone. All of us have cell phones, right? And pulling up funny stories, or I love just watching funny things just to get that heart laugh out, So I appreciate that as well. Thinking about those stress in particular, when you think about everything that's going on around us and the stress level of so many being high, I can't help but be concerned about how the church can support their congregation. Can you just share with us, what can the church do to support members who may be experiencing trauma, experiencing grief and loss, which is a type of trauma, right? And we've had COVID. Many of us have lost loved ones and friends. And those who are struggling from, a lot of jobs are laying off. I have a lot of clients who are very stressed right now, losing their job, and they say AI is replacing a lot of jobs. Can you speak to that and give some tips or techniques or resources to help people cope with all of the changes that are happening in our community? So we have deaths, we have the impact of COVID that some people have not recovered from, the loss of loved ones, loss of children, loss of parents. We have the stress of the economy, the financial crash that everybody's predicting. Can you address that? Is that too much to put on your plate today? There's a lot going on in the world,
I could take a stab at it just in terms of ways that the church can help support. The simple first step I can think of is creating a safe place for people to come together just to talk about it freely and not be dismissive about it, but just, recognize that each person experiences trauma differently, and the way that they sense it is different too. Just allowing them the freedom to be able to share it and not dismiss it.
So creating a forum where the members are able to talk about the things that are going on in their world.
Yes.
The tradition is Bible classes, Sunday school, Sunday morning worship. But I'm hearing you say do something maybe a little different and just have a forum where people feel free to talk and share.
Yes, because so much of it is internalized, and the body doesn't know what to do with it. So it's held on to, and it creates problems for the body.
Excellent. Thank you. My third question, with Black Americans experiencing the highest cancer mortality among any racial, ethnic group, for all cancers combined, wow. What can be done to reduce this disease burden?
You know,
that's pretty disturbing news.
It is. But actually, recent research has shown associations between like lifestyle stressors and chronic stressors actually facilitate this higher mortality among Black people with cancer compared to, non-Black counterparts. And one of the things they can do is find ways to de-stress. Like I said, find these spaces where you can talk freely, these platforms where you can share and listen. And it's tougher. Black people generally have, more blue collar jobs, more stressful jobs, more stressful situations overall, and just finding ways to de-stress. And that's, a major step towards decreasing the mortality rate.
Wow. So you're saying stress and cancer are linked?
Yes.
Wow, that's pretty powerful. So individuals have a responsibility to learn, I guess, techniques, strategies to reduce the stress. Collectively, congregations can also be aware, be sensitive to the needs of the congregation. I'm thinking, this is kind of, probably sounds weird, but I think about what can the church do, to help people who are suffering. I just think that way a lot. And I was thinking they could even have a comedy show in the church,
That's a good
where
idea.
people just come and share funny stories. It can be clean and they laugh. Just share funny things that have happened to you or funny jokes. And it's just a time of laughter.
I think
Do you know of any church that does that?
Currently, I cannot think of one.
But isn't that funny that we talk about the Word of God? And isn't that the Word of God that laughter doeth like medicine?
Yeah, that is.
That's just a powerful idea, isn't it? And I'm thinking, these are just some of the things that come to my mind. I was also thinking about karaoke. Do you know singing reduces stress?
Yeah, I believe it.
Well, because think of deep breathing, right? When you sing, you're singing from diaphragms and you're inhaling the oxygen. While dancing, singing, exercising, all of those things help to reduce stress. And I learned that since I've been a therapist. I've learned a lot being a therapist, but singing is very therapeutic, so they can come together and sing. And I don't know, but I grew up in the church as a teenager, and I remember them saying you couldn't dance on your own. You had to have the Holy Spirit move on you. And if the Holy Spirit wasn't moving on you, you were in the flesh. But I don't find any scriptures that says we can't just dance, but even just having fun. And you talked about that, coming together and just being with people is therapeutic. So there are a lot of things I think we can do individually and collectively. But we're going to pause for a break, and we're going to come back and just continue this discussion and talk about other strategies and technique. How does that sound?
That sounds great.
Thank you. We'll be right back. Stay tuned.
Dr. Starr, best-selling author of Golden Nuggets, Food for the Mind, Body, and Soul, is also a health and wellness speaker and consultant who provides motivational speaking, training conferences, and one-on-one coaching to improve the quality of life. She's passionate about helping people heal from the inside out. Dr. Starr provides creative and innovative self-care strategies that empower you to prosper and be in good health, even as your soul prospers. Call or visit the Golden Nuggets website today. Feeling anxious? Perhaps you're dealing with a past trauma and don't know where to turn for help. Turn to Unlimited Possibilities. We provide a safe and caring space for individuals and families to help improve the quality of their lives. Whether you need help with spiritual matters, trauma, depression, and more, Unlimited Possibilities can help you overcome your situation with compassion, acceptance, respect, and empowerment. Unlimited Possibilities, where all things are possible if you believe. Call or visit our website today.
And welcome back to Golden Nuggets Health and Wellness Show. I am here with Dr. Powell, and we have had a wonderful conversation about physical health and the Black community. And Dr. Powell, our last question was, with Black Americans experiencing the highest cancer mortality among any racial ethnic group, for all cancers combined, what can be done to reduce this disease burden? And I just wanted to ask if you could continue that discussion.
Okay. There's several factors. I mentioned one, earlier, but, some others are, just thinking about the fact that Blacks generally are underdiagnosed or misdiagnosed, or, even there's hesitancy within the Black community to go get checked out in time. There's also, there's barriers to health equity as well. But some of the things that they could do is, if you find yourself, get regular screenings for starters.
Sure.
Age-appropriate screenings is one thing. Another thing is, if you find yourself, with a cancer diagnosis and, there's no treatment, don't be afraid of clinical trials. I know, with the history, with the Tuskegee experiment and the history of clinical trials and Blacks' participation in America, there's been hesitancy, and reasonably so.
Yes.
But they're not what they used to be. So, go get educated, educate yourselves. But that's a great start to changing, some of the outcomes.
And I was thinking about the fear of going to a physician. Mm-hmm. What do you think that's about? You said you think it has to do with the history? Mm-hmm. Are there any other possibilities why a person would be afraid to go get checked out if they are thinking, I guess, and how would they know if it was cancer in the first place? I'm just curious.
Signs and symptoms, this is the age of information and technology, start to ask questions, I'm feeling this, just, examine yourself, for ladies, 45 and older, do regular breast screenings on yourself in addition to, going to the doctors. For males, go get checked out for prostate cancer. There's things you can do.
They don't have to be afraid.
Right. You don't have to be afraid.
And you said that times have changed.
Yes.
We're no longer living in the past history. Is that what you're telling us?
Absolutely.
Okay. Very good. So I wanted this second half, I wanted to talk about strategies, resources, techniques, anything that would help our audience improve their physical health. And I know I'm not a physician, but I teach strategies on reducing stress and anxiety, depression. And I also teach techniques to help the body to relax, calm down, and just general self-care. One of the things that I've found is helpful for our clients is to listen to your body. Pay attention to your body. For example, if you know you've been working excessively over time and you're exhausted, then stop, rest. I know individuals who are exhausted from working, they don't rest, they continue to literally drag their bodies knowing they are exhausted. And I know of one case where an individual fell asleep while driving. I know of another case where an individual was injured on the job. because they weren't able to think clearly, working with machines, and it was severe damage to their arm. They lost their limb. So pay attention to what your body is telling you when you feel tired, when you're having headaches. Check that out. Don't ignore it. I think the worst thing you can do is ignore your body when your body is sending those signals, feeling fatigued, feeling dizzy, having headaches. Stop. Pay attention and listen. Like our Dr. Powell is saying, contact your physician. Talk, tell them what those symptoms are, but just listen to your body. Rest if you need to rest. If you're hungry, eat. Don't push and pull and drag your body. You only have one body to live in, and you'll want to take care of it. What are your thoughts on that, Dr. Powell?
I think it was aptly put.
Thank you. It's so important that we love ourselves. Mm-hmm. And it really goes back to what we call self-compassion. And self-compassion simply means extending the same compassion that you would to a child. If your child came to you and your child was hurting, you wouldn't say, go sit down, there's nothing wrong with you. You would check them out. You would see where the pain is. You would provide comfort and support to the child. Well, do the same for you. If you're hurting, if you're in pain, pay attention and get the help, get the comfort, support that you need. Does that make sense, Dr. Powell?
Absolutely.
Practicing self-compassion. Well, Dr. Powell, how can Black Americans access quality health care and overcome barriers such as lack of insurance, mistrust, or discrimination?
I said it, a little bit ago. One of the most important things you can do for yourself is educate yourself. In the age
Absolutely.
of information, technology is at our fingertips. Ask questions, look up resources. State and local community have resources that you can access and find out, how to get certain things that you wouldn't normally know of. But educate yourself. That's probably one of the biggest barriers, I think, in the Black community is not knowing. A lot of times we do things because we've always done them, or traditions were passed down, or we just don't do that. I think it's time to get rid of that in the Black community and, go get the information for yourself.
So there's somebody out there going, where do I get the information? Even though you've said it, could you just explain the various resources, places, people, things where they can get the information to understand how to take care of themselves? We don't want to assume that everybody knows. Mm-hmm. So identify specific resources, places where information can be gained.
I'd start by asking someone who may have access. You could start with your state, government, go to maybe that website and maybe, whether it pertains to access to health insurance, they might have resources there. If push comes to shove, Google. But there are ways to find the things that you need.
And I'm thinking about experts that are that focus on certain aspects of the body. Mm-hmm. How would they find when you're wanting experts and you're needing help? How would they get that information? Where would they go?
So it depends. If a person is insured, you can use, maybe the app through your insurance to identify specialists or primary care physicians. If you're not insured, this is a place that I would say, contact your local, authorities to see how can I access health insurance, and if so, where can I find providers for a given disease or whatever it is that you need help with.
Yeah, I was just thinking, sometimes when you have insurance, you forget that there are people who don't have it. And I was just sitting here, I can't even imagine what a person would do if they don't have insurance. So you're saying go to the local government? Is that what you were saying?
That would be one of my first steps. If I did not have insurance, I'd see, what is available through the government.
Are there any other options?
That I know of, not at the moment.
For medical help? Okay. There are a lot of people out here suffering, you know? And we just want to be as supportive as we can. So I just appreciate you taking the time to be here, to share these resources, to share information. And if you don't mind, can we go back to the church a little bit?
Yes.
I was wondering, do you get opportunities to go and share your information and knowledge with congregations? You were talking earlier about having conversation. And I was wondering, is this something that you do often at all, go to churches and help kind of facilitate this conversation? That would be one way, right, for people to get the information that they need.
I've only done it a couple of times. My schedule doesn't exactly permit me to do that frequently.
Okay.
But yes, I have done that, and I'd be open to doing it more.
Well, I think with your knowledge and expertise, surely there are other creative ways you can share it. I think if there are pastors out there in the audience that would like to have you, is there a way that maybe you can collaborate on something?
Yes, I believe, we can figure out a way to do that.
Because I think you have so much information to share that would be so helpful. And I'm thinking about the number of people that I know personally who have died of cancer recently, and it just breaks my heart, And I'm sure there are family members that would love to have that information who have individuals who are struggling with symptoms of cancer. How would they reach you? How would they contact you if they were interested, or any groups out there would be interested in having you come and have that conversation?
Yeah, I wouldn't mind sharing my email with you to make available.
Okay, I think it would be wonderful. I'm just grateful that you're here today. The strategies, the resources that you're talking about, I want to kind of recap. You mentioned the importance of being around people, the talking, the sharing. Can you just elaborate a little bit on that piece? Because I think that's one that we don't take seriously. Some people call it communion, some people call it fellowship, but speak to that, the importance of that.
I think it's so critical for your physical health and mental health to surround yourself with a support system that actually supports you. It's important for you to feel supported, for you to feel safe. I think that all plays, critical roles in your physical health and maintaining it.
That is so awesome. So it's important for the church to create that welcoming environment, caring environment. And then it's important for the individual to know who are the people who value me. Recently, I saw something on Facebook by Oprah Winfrey, and she was talking at a graduation ceremony, and she said to surround yourself with people who value you. And she talked about the danger of being around people who don't. And she just said some of the things that happen is that they criticize you and they put you down and say things like, who does she think she is? And I thought, wow, that is so powerful. And so it is important to be around people, because she said when you're around people who value you, they rejoice with you. They're excited about your success. They're not envious. And she said it's actually a reflection. They're looking at themselves and they're seeing what they have not done, and they can't rejoice with you. So I appreciate you sharing that important piece. So we want to encourage our audience to be around those folks that value you, appreciate you, because that's part of the healing process. Absolutely. Thank you so much for being with us today. And as we wrap up today's episode, I want to extend a big thank you to Dr. Powell. She has shared invaluable insights with us today, and to our audience for joining us in this important discussion. Be sure to stay tuned as we continue exploring self-care for the Black community. Thank you so much for watching, and until next time, may you prosper and be in good health even as your soul prospers. Goodbye for now.